Hello, welcome back to my YouTube channel. Today is part 2 discussing things like histamine intolerances and mast cell activation syndrome, aka MCAS. These are drastically overlooked conditions, yet they make up at least 1 or more % of the population. They can affect multiple body systems ranging from things like skin rashes and allergic-like symptoms all the way to chronic pain, digestive upset, and things of that nature. And all of these things can have a common cause, which is related to histamine and our mast cells. So in part 1, I discussed why these are commonly overlooked, how the symptoms can present in all different types of body systems, and how to really get a good grasp on whether or not this is an issue you need to even be concerned about. But today I'm going to be going over the treatments. Now I'm talking about treatments that will be often recommended to people if your doctor knows what they're talking about. And I really do have that as a caveat because a lot of doctors are poorly educated in this. In fact, even in my own training, which is holistic medicine, very comprehensive in a lot of areas, barely glazed over these conditions. So I actually had to do a lot of my own research to really dive into these things further. So the point of today is to give you an idea of what treatment could look like, again, if your doctor knows what they're talking about. You by no means will need to do all of the things discussed in today's video, but hopefully I will make it clear why certain therapies are being offered and how they can be useful in the grander scheme of getting you better. But before I dive into all of that, I should probably introduce myself. My name is Dr. Robin Lewis. I'm a naturopathic physician practicing in Vancouver, British Columbia, Canada, and let's get into it. Okay, so before we jump into things though, I just want to give you an understanding of some of the key principles of treatment here. This is really to help you understand what these individual therapies are targeting, what part of the pathway are they really addressing, and which recommendations are redundant, right? Some of these things overlap as far as what they're able to do, so it might not always be necessary to take both of those things, but you might respond better to one versus the other for whatever reasons. So I'll try and make that really clear for you. The first mechanism that's commonly used in a lot of these therapies is to just simply overall lower your burden of histamine. And so that's where things like a low histamine diet would come in. Rarely is histamine in the diet the cause of all your problems, but if your body's overwhelmed with way too much histamine, then anything you can do to lower that histamine is going to be helpful. And so things like dietary changes are just aimed to try and reduce the burden as much as we can control, for example. Another common target of these therapies is to stabilize your mast cells. And so the mast cells that release the histamine and the other inflammatory compounds often are too easily triggered. They're dumping way too much, way too often. So there's therapies that are supposed to help stabilize those mast cells and cause them to release less often. And then another big principle is sometimes there'll be therapies that are going to bind a histamine receptor, for example, so that despite the fact that you have high histamine, it's not able to hit the receptors to have an effect. So you are trying to manage symptoms while doing the bigger picture work to lower the overall histamine. And I mention this because a lot of the therapies in this group of population is going to be symptom management. Sometimes you can find a deeper root cause. So for example, in the case of many people's mast cell activation syndrome, it's being triggered by a chronic infection like mold. So until you address the underlying mold issue, you're going to have to keep taking these therapies that just kind of get you by, which is no shame. But anything you can do to get at that root cause is likely going to stir the pot a little bit. So sometimes there is a huge emphasis on controlling someone's symptoms in the meantime so they actually can get through the other therapies to get at the root cause. And I don't say this to really confuse you, but this is really just the style of medicine that I'm in. Whole body root cause medicine. So for some people, they won't know what that deeper cause is. They just know that they have MCAS or a histamine intolerance. And then there's a lot of great therapies to kind of manage that in the meantime. And for some people, you can identify the deeper cause, the deeper trigger usually more in the circumstance of mast cell activation syndrome, but those sort of therapies will often take a long time to kick in. You're really working in deep, deep healing. And so most of the therapies talked about today are how do you manage your symptoms until you find a root cause, or just to get by on your day-to-day basis. And so hopefully along the way I can kind of explain which therapies are being used for what, so that you can make an educated decision with your healthcare provider, whether that be a doctor, a naturopathic physician, a functional medicine doctor, whoever you're going to work with. Just make sure they know what they're talking about, they're familiar with this condition, and these are some of the therapies that I see a lot of them using. So now let's talk a little bit more about the environmental triggers. So this is usually pertaining more to people with MCAS rather than a histamine intolerance, but again, sometimes it's very confusing and it's hard to tell the two apart, especially if you have a more mild version of MCAS. But the point is, a lot of different things can trigger your mast cells once you've developed this condition. And so that could be physical triggers. So that could be even things like temperature changes. That's why people will get things like heat rashes or reactions to cold and stuff like that. You can get chemical triggers. So this is like cleaning supplies, all these random chemicals we're exposed to in an environment. Emotional triggers, so managing your stress can be really helpful. Let's talk about some of the solutions you can use to reduce the amount of triggers coming in through the environment. So that's where things like really high quality air filtration can be very helpful to reduce the amount of airborne chemicals, dust and allergens like that, and mold. Now, I just want to spend a little extra time on mold because it's truly not as simple as just get an air filter. You need to do house remediations. And if you want to learn more about this, I did a whole episode on mold illness, or I did multiple episodes on mold illness. I mention this because it's a very common root cause issue for people with MCAS. If you have a ton of mold residing within your body, it is going to constantly trigger your immune system. And so yes, a really good air filter will help in the meantime, but it's truly not the ultimate solution. If you have water damage and mold growing behind the walls and stuff, an air filter is not enough. So I just wanted to briefly mention that and not downplay the mold situation, but air filtrations can be helpful in the meantime. And certainly if you don't have mold illness, then air filtrations can be a more better solution for you that isn't so minimal in its effect, I guess. Okay, so the other thing is thinking about your beauty products and your cleaning products. You want fragrance-free, hypoallergenic. We could do an entire topic on just all the weird chemicals that get put into your skin creams, your makeup, your cleaning agents, your detergents. Like all of these things could be a lot more simple and fewer chemicals are needed, but a lot of these companies will add all these chemicals that trigger people. So you can often find simpler versions that are more hypoallergenic and far less triggering for these particular individuals. And if you're not sure on whether or not these are issues for you, a lot of these tests are actually available. Rarely are they built into our public healthcare system, and certainly here in Canada they are not. But if you go private and you use some of these private labs, they can test for things like heavy metal exposures, which is a very common trigger for people as heavy metals build up and don't easily excrete from the body. You can test for things like abnormally high pesticides levels. And of course, we know that pesticides are not good for us, and we're exposed to quite a lot of them. So a lot of the times these are things you could actually confirm if you know that these tests are available and if you work with a healthcare provider who also knows that these tests are part of the equation. So I say that because a lot of you want more concrete answers before committing to these things. So just note things like mold you can test for, things like toxins you can test for, so that you at least know that your pursuits are worth the effort. And so this doesn't always have to be a theoretical thing, you can confirm it for some. And the last thing I want to mention before we dive into the prescriptions and the supplements that can be useful here is something to address the nervous system. So this isn't entirely environmental, but of course it could be. So a lot of stress and environmental triggers kicking us into our fight or flight are not going to help, because many of these people are already in that dominant fight or flight mode because of the histamine intolerance, because of the MCAS picture. So if you're getting things like dizziness, headaches, brain fog, anxiety, some of the more nervous system related symptoms, then doing something to help balance out the nervous system and reduce the amount of stressful triggers in your environment could be very, very helpful. If we just look at it from a very basic standpoint, when we are in our fight or flight mode, we don't heal well. And as a general population, we have way too many things in our environment that kick us into that fight or flight mode, like traffic, like dealing with work and colleagues, and dealing with a chronic illness, for example, that your doctors don't know what's going on. All of those things, very stressful and promote our sympathetic mode. But all of the good recovery and a more healthy, balanced nervous system also spends just as much time, if not more, in our parasympathetic rest and digest mode. That's where we heal, that's where we digest well, that's where we're calm, cool, collected. And so we can't always control the triggers in our environment, although that is a worthy pursuit. Sometimes it's more about adding intentional activities that promote the parasympathetic, like meditation, like cold plunging can eventually get to, saunas, gratitude journaling, walks in nature, acupuncture. A lot of these therapies are geared towards promoting a more balanced nervous system by promoting the parasympathetic. And so many people would benefit from doing a little work in this area, because a lot of this population have problems with their nervous system, which balancing out the nervous system will not only help from a symptom management standpoint, but from an overall recovery and healing standpoint. But let's get into the supplements and the medications used for histamine intolerances and mast cell activation syndrome. So I'm going to start by talking about the prescription medications, because they're the common first-line therapies for a lot of these people, especially if you have more severe situations like an MCAS. Not as much with histamine intolerances, but still some of these things will be relevant for a histamine intolerance as well. And it isn't uncommon that sometimes you'll have to be on multiple medications or circulate through different ones and test your tolerance, because you're in general overreactive, right? Like that is kind of the definition of this condition, is these cells are sensitive and responding to weird things and triggered easily. So just because the therapy is designed to help doesn't mean it always will help. So I mention a lot of different things because sometimes you have to find the right pill for the right person, sort of thing. Sometimes you can combine natural therapies with prescribed therapies, and sometimes you just need to kind of double down on a few things to get some really good symptom management until you can do the deeper work. I, as a naturopath, obviously prefer to avoid prescriptions at all costs, but there are exceptions to the rule, right? There's a reason prescribed therapies can be helpful. And in this demographic, sometimes they're necessary, because sometimes the supplements just aren't strong enough, they're not cutting it, and ultimately you just do whatever makes people feel better. As long as people understand why they're doing the things that they're doing, and maybe this is just a temporary fix until we do the deeper work, or whichever way we're kind of approaching things, there's no shame in prescribed therapies. And so the first and most commonly prescribed are the antihistamines. And this can be H1 blockers or H2 blockers, which is referring to whether it's blocking the histamine 1 receptor or the histamine 2 receptor, which two can have different effects. And so H2 blockers, for example, are typically more used for gastrointestinal symptoms. You commonly see them prescribed for people with reflux. And so sometimes you're just finding the right antihistamine for someone. And sometimes that's an H1 blocker, sometimes that's an H2 blocker, or sometimes that's a combo of the two. And there's many different types. So these are a category of prescriptions that are commonly used. The other common category prescribed for these patients are the mast cell stabilizers. Again, a prescribed therapy to stabilize those mast cells. And so that's commonly things like cromolyn, which can come in many different forms, or ketotifen. And these, again, are just helpful tools. Sometimes you do one, or sometimes you don't do them at all. There's also therapies that are commonly used here to control more of the inflammation aspect of mast cell activation. So that would be things that address your leukotrienes. So I'm just going to read them off quick because they're very hard for me to pronounce. So montelukast and Zoloton, I'm probably prescribing those horribly, are actually common asthma medications, but they deal with more of the inflammation that's related to the asthma, because asthma is a form of a histamine problem. So a lot of the times in reaction to various triggers in your airways, you dump a bunch of histamine and can get that wheezing and those bad forms of asthma. So that's why there's an overlap here. So some of the asthma medications can also be helpful in this demographic, but that's more the ones that are geared towards controlling leukotrienes, which are an inflammatory compound. So blocking various different parts of that pathway to help control inflammation related to the mast cell activation syndrome. Now, of course, there are other things that are usually used after all of those fail, which are more like strong anti-inflammatories like steroids and things along those lines. So there are a whole set of like second and third and fourth line therapies that are like last ditch effort therapies for more severe cases. But for most people, they will respond to the ones I just mentioned. Now, before we move on to the supplements, I want to just briefly mention the binders and the fillers again, because a lot of these meds have non-medicinal ingredients added to them to, again, fill the space, make it into a certain form of a tablet and things like that. But people can often react to the fillers or the binders, making them not able to tolerate the medication that could help them. This is where compounding pharmacies can be really helpful, so they can kind of custom make these medications so they have fewer of the binders, or at least not the ones that you react to. But accessibility can be a big issue. It really depends where in the world you are, what labs are okay to do these certain things. And so it's not always the most accessible option, but I just wanted to bring that up for some of you who are more severe and do react a lot to the binders and the fillers. Sometimes the compounding options are an alternative option to explore if all else fails. Now, if we move on to the supplements, there's a lot of really wonderful supplements. The first one I always think of is vitamin C. Vitamin C is really good at helping the breakdown of histamine and stabilize the mast cells. It's really good for your immune system as a whole, which I think is something that we all know. But the mast cell stabilization, the histamine breakdown are obviously things that are unique to these particular conditions that are particularly helpful. That being said, it can depend what form of vitamin C you're taking. So generally speaking, you have to take high doses of vitamin C to have those mast cell stabilizing effects. But depending on the form, sometimes you're reacting to the vitamin C, and obviously that's counterproductive. So for example, one of the most common forms of vitamin C, ascorbic acid, is generally speaking made from fermented corn. It's just part of the process of making that type of vitamin C. As I've discussed in more of the diet section, fermentation can be an issue for some people. And then the corn thing is interesting because corn commonly triggers people with mold illness. And so that could be a reason why you're not tolerating your vitamin C very well. These things can get very complicated, but there's things like magnesium ascorbate or camu-camu that are processed a little differently and sometimes are less reactive in this population of people. And so just something to consider, because again, you might react to even the vitamin C and not know why. And sometimes you can get away with the vitamin C if you just switch the form of the vitamin C. Another really popular supplement for these people is something called quercetin, which is a flavonoid found in a lot of different wonderful herbs. So they kind of concentrate this compound and put it into a supplement, and it is a very good mast cell stabilizer. So that's the side of things that it's really helpful for. It also happens to be a really good antioxidant and anti-inflammatory. So there's probably some added benefits coming from that as well, but it's really the mast cell stabilizing portion that we're concerned about. But similar to vitamin C, you typically have to take quite a lot of it. So just keep that in mind. Also, it can interact with certain heart medications and antidepressants. So if you're on multiple different medications, just really make sure that you're consulting a healthcare provider first and just making sure it's not going to have a negative interaction with your other medications, which there aren't a ton, but there's enough to mention it, right? Now, there's a few supplements I want to mention that have more to do with the breakdown of histamine. So the first thing is DAO enzymes. And again, please go back and watch part 1 if you want to learn more about this. But it's essentially one of the main enzymes used to break down histamine. And a lot of people have issues with that enzyme, which is leading them to this high histamine picture. So you can take an oral supplement of that with food that will overall lower the amount of histamine and the histamine reactions that many of these people will get to everything that they eat. And so DAO enzymes can be especially helpful if you get a lot of reactions with food. And it's a very easy to access type of supplement that you can just take easily over the counter. Now, there is always a question of like, why isn't this enzyme working to the best of its ability already? And for some people, they're just genetically unlucky that way. But that enzyme, like many enzymes inside the body, does rely on other nutrients to function properly. So things like B6, copper, magnesium, and zinc help that enzyme work better. So sometimes deficiencies in those can be the reason your DAO enzyme isn't working as well as it could. And things like a magnesium deficiency are actually more common than you'd think. And so that's another area that you could explore. It's like, are you deficient in certain vitamins and minerals? And can those be given to support this enzyme along with many other things that are likely being affected by low magnesium, low zinc, and things like that. So DAO is one enzyme. The other main enzyme that helps break down histamine within your cells is something called histamine N-methyltransferase. And as the name is kind of suggesting, it is heavily reliant on methylation. Now, not to overwhelm you, there is a whole set of videos that I've done on methylation alone. So I am going to kind of glaze over this topic, but methylation issues affect approximately 60% of the population. And that means you're not a very good methylator. So that could have knock-on effects to this particular enzyme that heavily relies on something like methylation. And so methylation supportive therapies, which can be various different vitamins and supplements, they can be very, very helpful in this demographic of people. You see a lot of these people with Mast Cell Activation Syndrome and histamine intolerances also having methylation issues. If you can address the methylation issues, sometimes that is the root cause of why you're overreacting. And so that's its own separate topic though. So I bring it up to glaze over it, bring it to your attention. But if you want to learn more about it, please go check out my videos on methylation. Now this episode could go on and on and on. So I'm just going to glaze over a couple common ones very quickly. So there's other things like resveratrol or luteolin, which are also mast cell stabilizers. They are not usually the first thing I think of, but another option if you don't respond to the first ones. Things like nettle, so a really wonderful herb that is acting as an antihistamine. That's a common one that's given in various different forms. So it could be pills, teas, tinctures, things of that nature. Sometimes you're doing some things to just simply calm inflammation from a more natural standpoint. So that could be things like low-dose naltrexone. That could be things like PEA, which is really good for more nerve-related pain. And so the supportive therapies to manage all of the different symptoms associated with these conditions can be quite broad because, as I mentioned in part 1, almost every single system could get affected. So today I talked about the things that are more specific to the histamine pathway, more specific to mast cells, but then there's an argument to be said that you can do plenty of different things to manage all your symptoms. And for many of us, as I mentioned, you're gonna have to just do what you gotta do to get you to be less reactive so that you can do the deeper work, or at least until you can figure out what the root cause is that's triggering everything and setting everything off in the meantime. So I hope you found today's episode helpful. If you have any experiences, please share them below. This is a condition that so many people feel alone in because nobody's talking about it, even though a lot of you are likely suffering from it. So I love those sort of comments, and certainly if you have questions, please ask them. I'm not allowed to give you actual recommendations, like personalized recommendations in the comments section. So please just keep that in mind. If you're asking for a specific recommendation, what do you think about my set of symptoms? I'm legally not allowed to answer those questions, but if they're broader, more generalized questions, please comment away, or you could comment and hope someone else shares insight for you. So thanks again for listening. Have a great day and take care.